And good day. I am Andrea Mitchell in Washington. As the country's top public health officials continue to testify to Congress about COVID-19, disease, of course, that has already killed 120,000 Americans and is now surging in states from Florida to Arizona, where, of course, the president is heading at this hour. The focus at today's hearing, Dr. Anthony Fauci, whose warnings about face coverings and social distancing have been repeatedly ignored by President Trump, Vice President Pence, and the Trump campaign.
If you look at how we've been hit badly. In some respects, we've done very well. In other areas of the country, we're now seeing a disturbing surge of infections that looks like it's a combination, but one of the things is an increase in community spread. And that's something that I'm really quite concerned about. That the next couple of weeks are going to be critical in our ability to address those surgings that we're seeing in Florida, in Texas, in Arizona, and in other states.
And that concern, of course, has been dismissed again by President Trump ahead of his Phoenix speech before thousands of young supporters in a megachurch whose leaders are touting a totally discredited so-called cure. The president has also alarmed doctors with his comments in Tulsa that he told his people to slow the testing in order to hold down coronavirus numbers.
They called me, they said, the job you're doing, here's the bad part. When you do testing to that extent, you're going to find more people, you're going to find more cases. So I said to my people, slow the testing down, please.
None of us have ever been told to slow down on testing. That just is a fact. In fact, we will be doing more testing.
Joining me now, NBC White House correspondent and Weekend Today co-host Kristen Welker, NBC Capitol Hill correspondent Casey Hunt, host of KCDC, and Dr. Joshua Sharfstein, Vice Dean for Public Health Practice at Johns Hopkins Bloomberg School of Health. Welcome all. One of the things that we heard at this hearing today was repeated questioning about the vaccine, and both Dr. Hahn from the FDA and Dr. Fauci saying that it's very hard to predict. They were going into stage 3 trials, but they have to have enough people to test, enough virus out there, and they're testing in South Africa, they said, and in Brazil, for instance, in order to have enough data to move to the next stage and to prove that it is effective. And Casey Hunt, the most important thing I think that Dr. Fauci said, aside from denying that there is political pressure and that he's been told to slow down any of the testing, was that they want to be sure that the vaccine is effective, that the worst thing that they could do is come out with a vaccine and start using it before they know it is truly effective against COVID-19.
That's right, Andrea. And of course, there is a lot of concern that not ensuring that rushing to a vaccine to the point where it caused problems or wasn't effective would be such a tremendous setback for so many reasons, both public health reasons and also political reasons. I think it was heartening for many to hear that Dr. Fauci said it's a question not of if, but when we're able to make these developments. I think there are a lot of people who breathed a sigh of relief at hearing him say that. But again, he also, as you point out, was particularly cautious. And he said that in particular, they are taking only financial risks here. And he underscored that in another answer to a member of Congress who was asking about this. The financial risk being investing in buying doses, buying basically the materials that you need to actually deliver the vaccine before we actually know if there's something that they could actually put in that to make it effective. But that would potentially mean that it could be distributed quickly and widely and ideally without costing Americans quite a bit of money. So I do think his answers on these vaccine questions are going to move that forward as we continue to talk about how we're ultimately going to end this pandemic, if that is still, of course, possible. He said the next couple of weeks are going to be very critical for the areas where we're seeing community spread. But he also also, of course, did address what many of us have been wondering as after the president made those comments at the Tulsa rally, where he suggested that he had ordered his task force to slow down testing potentially for political reasons. And this morning said, he wasn't kidding, as his aides had suggested that he was. Dr. Fauci was very direct in saying that to his knowledge, he certainly, and to his knowledge, no other officials had been asked to slow down testing for this reason. And after questioning from the ranking member, the Republican, who went down the line with these officials and asked them to answer the question of whether they had been pressured, they each in turn answered no. Now, I don't think that's going to be enough for many members of Congress. We know senators have requested an IG investigation into this question, so I don't think this is going to be the last that we hear of it, Andrea.
And Kristen Welker, you've got two realities here. Anna Eshoo, the congresswoman from California, was just making that point. That she said, put on your white coat, your doctor's jacket, tell the American people, because the president and the vice president have not been modeling CDC guidelines. And again, today, the president's heading into a hotspot, Arizona. We see, breakouts in Phoenix and even in Yuma at the wall. We're going to be hearing later from Jacob Soboroff and others from where the president's going to the border wall. 2 people have tested positive there, workers on the wall. So how do we get around this where somehow public health has become so politicized?
Well, I think you've hit at the heart of it, Andrea, the fact that President Trump and the vice president are eager to turn the page, to put the focus on the campaign. The president making the argument that the economy is starting to come back as the country slowly reopens. And we saw that dichotomy on display this weekend in Tulsa when you had thousands of people packed into that arena, a number of them not wearing masks. The Trump campaign saying, yes, they handed out masks, but didn't mandate that people wore them. And of course, on Saturday, we learned that 6 advance staff tested positive for COVID-19. And then yesterday, NBC News was first to report, Andrea, that 2 more advanced staff members tested positive. So you have 8 people who have tested positive, which really looms large, I think, over all of it. It makes the point that despite the fact that the president is eager to turn the page, this is a virus that continues to march on. And you heard that in what we just heard from Dr. Anthony Fauci, who said he is concerned about the uptick in community spread, and President Trump heading to Arizona, where we are seeing a spike in cases. His 3rd stop today is going to be to speak at that mega church, which fits 3,000 people. No word on final attendance, Andrea, but there is concern that these indoor events could only help to increase the spread all the more. Now, President Trump's entire response has come under scrutiny, including and especially those remarks that he made in Tulsa. A number of White House officials again said they were in jest when he said that he had told his own staff to stop the testing, to slow the testing. He's been pressed on that a number of times, Andrea, including today, just before he departed. Take a listen to what he had to say.
We test, we're going to have more cases. By having more cases, it sounds bad. But actually what it is we're finding people. Many of those people aren't sick or very little. Here's what I say. Testing is a double-edged sword. In one way, it tells you you have cases. In another way, you find out where the cases are, and you do a good job.
Andrea, this has been the president's talking point for quite some time, which is that with more testing, you get more cases. And of course, top doctors have said, yes, that may be the case, but that does not account for this increase that we are seeing now in more than 25 states, Andrea.
And Dr. Sharfstein, testing is not a double-edged sword. Testing is a positive. It tells us where the cases are and how we can deal with them. And testing is not the be-all and end-all. The real measure is hospitalization rates. And how concerned are you about what you're seeing in Florida, Texas, California, and Arizona?
Well, it's extremely concerning. And I think, people could be forgiven for thinking they have double vision. On the one hand, you have the president playing things down, the vice president saying things are turning around, don't pay attention to the testing numbers. And on the other hand, there is a real problem in certain states in this country, reflected not just in the number of people with positive tests, but hospitalizations, ICU beds, ventilators. And there's not an end in sight. I mean, we're going to have to realize that It's what we do, what every single person does, what our governments do that is going to fight the virus. The virus is going to do its thing, and it's up to us to stop it.
And our thanks to you as we continue to watch what the president is doing today. Thanks to you. Thanks to Casey.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.